Hi everyone, my name is Taylor and I did my disease research project on gonorrhea, also known as Neisseria gonorrhoeae. A little bit about gonorrhea and the biology behind it is that gonorrhea is a sexually transmitted disease caused by a gram-negative bacteria named Neisseria gonorrhoeae. This bacteria has a kidney bean-shaped appearance under a microscope. This bacteria is encapsulated, non-spore forming, meaning it doesn't rely on spores to survive, non-motile, meaning it cannot move on its own, and it requires its environment to be aerobic. Gonorrhea can be transmitted through traditional sexual contact such as penetration, or it can be transmitted through oral contact of the penis, vagina, anus, and even mouth to mouth. Ejaculation does not need to occur for gonorrhea to be transmitted. This disease may also be spread from mother to baby during vaginal birth if it's not treated beforehand. Some things to expect if you're diagnosed with gonorrhea is that a majority of patients diagnosed with gonorrhea have reported experiencing zero signs or symptoms. Gonorrhea is treatable with antibiotics. Infections, but primarily sexually transmitted disease and infections, can be very dangerous if they are left untreated. These diseases and infections can lead to serious complications such as infertility, ectopic pregnancies. It increases your risk for developing HIV, and in rare cases, it can travel through your bloodstream, which could be life-threatening. In the United States, gonorrhea is the second most common STD in males and females, with over 600,000 cases per year. Some symptoms of gonorrhea in women are increased painful urination, abdominal pain, vaginal discharge, abnormal bleeding, and in men, some symptoms include painful urination, swelling of the testicles, pus-like discharge coming from the tip of the penis. Some symptoms in both men and women include rectal itching and/or pain, and sore throat and lymph nodes. Some treatment options for gonorrhea include, if you're under 150 kilograms or 330 pounds, a single 500 milligram dose of ceftriaxone is injected. If you are over 150 kilograms or 330 pounds, a single 1 gram dose of ceftriaxone is injected. If ceftriaxone is not an option for you, such as you are allergic or resistant to that antibiotic, a single oral dose of cefixime is prescribed. 7 to 14 days after treatment, another test is performed to ensure that the infection is gone and the antibiotics worked. Some ways to prevent gonorrhea. One of the best ways to prevent gonorrhea is to practice safe sex and always use condoms, even during oral sex. Women's condoms, if placed correctly and used every time, can also be a great way to prevent gonorrhea. Refraining from sex and sexual acts will guarantee that you don't come in contact with gonorrhea and/or other STDs. Talking with your partner is important. Talking with your partner about safe sex could also help protect both parties. If you test positive for gonorrhea, it's also important that you inform them so that they can get treated as well. It's best to stay on a yearly schedule to get tested for STDs and STIs if you're sexually active. Limiting your partners is also very important and will also help lower your risk for gonorrhea. I included some pictures of the pamphlet that I printed out and had made as a physical copy. It has all the same information that we just went through, but it's just a physical copy. Thank you so much.